Tugusu utie. Jumadi Chairman, the Chairman General Kwame Safakai. Ano pay me out to me care frame and I orchestra bet me a frame the Cardinal. Tim I mean we are Jumano pay Dr. Father Dixon Kennedy Asante Osei also for Kojo Asante Stephen Bafo Michael Ejari Arafat Peter Squad Pretty Joyce and flip side I no pay Odi Ahenkai Kwame Yaboa and Afi Mami Biama Kwafo Emma Munyanachi no pay the Masisa Mudia Fidina to Peace 104.3 now Utie Jumedia friend of Kokrokoo and JBI Ebeko Studio 2 now Yane Dr. George Haramis our doctor Orisha Jun Somu Yare now our home operation. So Dr. George Haramis is here. We're talking this morning about kidney stones and prostate enlargement. Good morning, Doc.
Good morning.
How are you?
I'm doing fine. Thank you so much for having me.
Sure. My pleasure having you. Good to see you as always.
Okay. Yeah. It's been a while.
Yeah, it's been a while. I asked of you one day and they said you had traveled.
Oh, yeah.
But they didn't tell me you were back. Anyway, how is Luca Health?
It's doing well. It's doing really well.
We thank God. So this morning we're speaking about kidney stones and prostate enlargement. What is it to say that somebody has a kidney stone?
First of all, we need to identify whether he has a stone or not, because not all patients are aware that they have a stone. Because there are two types of patients, as I said. The first type of patients are those that all of a sudden they experience some pain. Usually it is a stabbing pain in the flank, it can radiate to the abdomen, or they can have difficulty passing the urine. They can even see blood in the urine as well.
Okay.
So these are the people that usually they seek medical advice, and when we do the imaging, we can identify having a stone, and then we treat accordingly. But there is also a big number of patients that they don't have any symptoms at all, and this is the most dangerous part, because you can have a stone inside your kidney that can increase with time, and it can eventually even cause a renal failure. It can even destroy the function of the kidney. So that's why it is always important to make a checkup, because many times we incidentally find stones and then we can treat them. Okay.
So at what point do you decide to investigate whether the patient has a kidney stone or not?
As I said before, usually there are patients that are coming to see me, for example, because they have already a persistent pain, usually pain in the back.
Okay.
And this pain is sometimes very intense, and they need to take painkillers. And usually, whenever that happens, my first idea is to make an imaging to see whether they have a stone or not.
Okay.
And then the treatment depends on the size of the stone and the location of the stone. And of course on the number of stones. Some people, they come and they have more than 2 or 3 or 4 stones. So usually these people, they definitely need a treatment. You cannot leave those stones grow.
Okay. So are there symptoms that come with kidney stones?
Yeah, as I said before, usually it's the pain. The number one symptom is the stabbing pain. It happens suddenly. I mean, the patient tells you that I was fine, I didn't have anything, and within seconds, I started feeling this intense pain, and I couldn't find a comfort place to sit.
Okay.
Sometimes also there is a nausea, there is vomiting, even fever in certain cases, even infection also.
Okay. Is it a lower part of the back or?
No, it's in the upper part, in the back part, in the flanks.
Okay.
The pain is in the flanks, but it can radiate also in front, in the abdomen.
Okay.
And sometimes it is related also with urination. The patients report that they have difficulty passing the urine.
Okay, so how do you, are there tests to do to confirm that yes, these symptoms are probably as a result of kidney stone?
Yeah, usually, as I said before, the gold standard to identify a stone is to make an imaging, either an ultrasound and even better a CT scan, because the CT scan can really identify the stone, the location of the stone. Okay. And usually the stones cause symptoms when they block the passage of the urine.
Okay.
And this is what I want to. That's why those people the patients that don't have any symptoms at all are usually patients that have stones inside a part of their kidney, but the urine finds a way to pass.
Okay.
So these patients, they don't have symptoms, or sometimes they have some indirect symptoms. For example, they have a lot of infections, urinary tract infections.
Okay.
And sometimes they wonder, why do I have infections? And all of a sudden you realize that they have a big stone in the kidney. So usually, as I said before, the stones that are blocking the passage of the urine are the ones that bring the patients to the doctor.
Okay, so let's now say that a patient has come to you, you have done all these investigations and confirmed that indeed it is a kidney stone. What next?
So first of all, it's important to identify the size of the stone. We don't treat all the stones. We don't need to make an intervention, for example, for a small stone. If it is a 5 millimeter stone, we can give some medication and we can wait with time, and most probably this stone will come out by itself. Okay, so not all stones require treatment. However, the bigger the size, the higher the chance to treat it. For example, a stone from 7 millimeters and higher, it would be extremely difficult to pass. So at this stage, we have to decide to treat the stone, and we have to fragment it and remove it. How we do that? We do that with the help of technology. Now we do endoscopic procedures, which means no more cutting. We have some small scopes now that can pass from the urethra, where the urine is coming out, and we can go from the urethra to the urinary bladder, to the ureter, all the way up to the kidney.
Wow.
And the technology now gives us a chance that we have such a small scopes that are only, imagine, 3 millimeters in diameter with the digital view.
Okay.
So we can really navigate all the way up to the kidney and find the stone wherever that is. Once we find the stone, we can pass a laser fiber through the same scope, and we can fragment the stones, and we can remove it in pieces, or we can just make it dust. And what is different from a few years back is that this is just a procedure that can be done in an ambulatory setting. It means that the patient can come, can do the procedure, and the same day he can return back home. And that is very important, as you understand, because it's not a long hospitalization. The patient can return back to its activity very fast and can get rid of the stone immediately.
But the assurance is that there won't be any cut.
No. We don't. The cutting now some operations that are operations of the past. I mean, we basically don't do it anymore. Of course, for very, very big stones, sometimes it will require more than one session, I have to say that. But the lasers now are so powerful and so strong that no stones can resist to them. So most of the time we're able to solve the problem with one session.
Okay, so we've been talking about kidney stones. Is it a hereditary condition?
It can be. Stone formation actually is a multifactorial disease, if we might say so. Genetics play a role. For example, we know that people that have a first-degree relative, like a father, mother, or brother with kidney stones, they have a higher chance to make a stone. But as I said, it's a multifactorial disease, which means it depends, for example, from our lifestyle habits. With number one is the drinking of water. If we don't drink enough water and the urine is very concentrated, then it is much easier for certain minerals to precipitate and form stones. They fuse to one another and they make stones. Okay. Also, the type of food that we eat. We know that salty foods also can cause stones, or consumptions of red meat. If we like to eat a lot and many times per week, that also puts us in this position. And also it's the geography, the location. I mean, in areas that we have a hot climate, like here in Ghana, that we're staying outside for long and we walk too much and we're sweating, that means that we're losing a lot of fluids. So if we don't drink that much, there's a very good chance that we will develop a stone at some point. Okay,
so do you advise, is it a condition for only men?
No, absolutely no. It can affect everybody, from children up to older patients. Men are a little bit more prone to stone formation than women.
Why?
But we can see stones even to children. But the usual age of presentation, I mean, the majority of the patients are between 30 and 40 years old, in the 30s and 40s.
Okay.
We might say.
So, prostate, you do recommend that periodically people go to hospital to check their prostate conditions and stuff. What about kidney stones?
The kidney stones, if there is a history in the family, of course, I always suggest to make a screening, because there is a chance, as I said before, to have a stone as well. But in general, it's always good at least once a year to have a checkup, because, for example, this month is the month of is the awareness month for prostate cancer. So it's good for all men to, for example, to come and do a checkup. In the same setting, I think when we check for the prostate, we always check for a stone as well, because we do an imaging, we do an ultrasound. So many times we can incidentally find a stone. So I recommend once a year to do a checkup.
Okay. Now tell me about prostate enlargement. What is it?
So the prostate enlargement is a natural process. It happens to all men. As we grow older, the prostate gets bigger. Of course, the difference between patients is how fast this enlargement is happening. But in certain patients, this enlargement can happen really fast. And sometimes this can even lead to a condition called retention, urinary retention. It means they're not able to pass at all. And many times some patients, they found out that they have an enlarged prostate like that. I mean, all of a sudden their urine is stopped, and they need to go immediately to a hospital, so a catheter needs to be put. And this is how they found out that they have an enlarged prostate.
Okay. So what happens to a normal being that has discovered that he's having prostate enlargement?
So if you have an enlarged prostate, doesn't mean necessarily that you need a treatment, because it depends on the symptoms again. Okay. If you can have a big prostate, but if you pass the urine very well and you have no issues, and for example you don't wake up during the night, you don't have any urinary frequency and so on, we just monitor it every year. As I said, with an annual checkup, the urologist will check and will identify if something is changing with time. But once the quality of the urination is changing, as I said before, I mean, the urinary stream becomes very weak, or the patient spends too much time in the bathroom, it has difficulty initiating urination, or it wakes up many times during the night, this is an indication that it requires treatment. Initially with medication. We give some medications that we can help the patient to empty his bladder. But for those patients that the medications have failed, or as I said, to patients that they have repeated episodes of retention and they have been catheterized so many times, I think this is an indication then to move forward for a surgical intervention that will give a permanent solution.
Okay, so at what point do you introduce the catheter?
The catheter, as I said before, is introduced usually in an urgent situation, like when the patient cannot pass the urine at all. This is a very painful,
serious condition.
Very painful situation. The patient, as the time is passing by and he's not able to pass, he's feeling more and more a pain in the lower abdomen. It's becoming very agonizing. In this situation, we have to put a catheter immediately. But after we put the catheter in and we give some medication, then we have to plan how we can solve this problem.
Okay. Is that also done through minimally invasive surgery?
Of course. And this is the way we treat cases like that at Luca Health. Again, a lot of patients are very scared of prostate operations. They have heard a lot of stories of open surgeries or bleeding operations, because the prostate is a vascular organ. So what we're doing at Luca Health, and what is the gold standard nowadays for the treatment of prostate is prostate enlargement, is to use again some scopes without any cutting. We go through the urethra, through the penis, and we remove the part of the prostate that is blocking the passage of the urine. We don't have to remove the whole prostate. What is really different nowadays with these operations, because these are not new operations. We used to do transurethral, as you say, operations through the urethra since long time, more than 15 years, 20 years. But what have changed over the last few years is the energy you apply to the tissue. So at Luca Health, we have two different types of procedures that we can offer. The one is the so-called plasma vaporization, that we vaporize the tissue so the tissue goes away. Or for some bigger prostates, we can even do a laser prostatectomy. So we apply a special laser on the prostate. The advantages of these techniques are that, first of all, that at the same time that we cut the tissue, we stop the bleeding. So there is no need for having blood units before the operation, because we don't have to transfuse the patient. So we cut and we stop the bleeding at the same time, and that that makes the operation much safer. And the way now that this technique has evolved, it gives us the chance that we can bring the patient in the morning, we can operate them, and the same day the patient can return back home, of course with a catheter for 2-3 days, and then he can come back after 2-3 days and we remove the catheter. And also because of this evolution of this technique, now we are, it's easier for us to operate even older patients. In the past, older patients, we couldn't operate them at all. We used to tell them you stay with a catheter. But nowadays, this is not the issue. If the patient is fit, and this is something we always check before operations like that, we always pass them through a series of tests to get the so-called medical clearance to see that they are fit for the procedure. Now we have the chance to operate in patients at their 80s. That this thing, a few years back, it was almost unthinkable and scary. But now it can be done. And the fact also that the patient can be mobilized and return home the same day, that also is very good for him, because it's not exposed to any infections, it can return back to its activity. And most importantly, I mean, you can get rid of the catheter, especially patients that they have the catheter for so long. I've seen patients having it more than a year. So you can imagine the consequences for a man to have a catheter permanently. And I think this is a great opportunity to do a procedure that will help him to return back to his normal quality of life.
So the assurance you're giving us this morning is that prostate is treatable?
Absolutely. Yeah, it can be treated.
Permanently?
Of course. If you do the right procedure and everything goes as planned, they can give a permanent solution that will require no more medication also. There are people that take the medication for years, and after the operation there's no place for medications.
Okay. So for those listening to us this morning, suspecting kidney stones or prostate enlargement, what do you require that they do? Where will they find you? Should they want to speak to Dr. George Haramis? What should they do?
So Luca Health is at East Legon. We are at the campus of MDS Lancet, 27 Maseru Road. We're just behind the Mensvik Hotel at Lagos Avenue. We operate from Monday to Friday from 8 a.m. in the morning until 5 p.m. And whoever wants to make an appointment to see me or any other of our specialties at Luca Health, he can call to our telephone center, book an appointment. The number is 0544 120 777.
Take it again, Doc.
0544 120 777.
777.
We'll be more than glad to see and help any patient that wants to do a checkup or it wants to share with us any medical condition that it has.
0544 120 777.
120 777.
120 777.
Right.
Okay.
Correct.
All right. That's fine. So, Doc, your parting words with us this morning.
Sorry?
Your parting words. Your final words for us this morning.
So, I think, first of all, the message I want to pass to our listeners is that they shouldn't be afraid to come and see a doctor. A specialist can always offer them a lot of options. That's the thing I want to stress. And it's important, the annual check and the regular screening, because it can really not only save their life, it can really change their life. And they shouldn't be afraid to come and see a urologist.
Okay. We hope to see you another time when time permits.
With pleasure.
Thank you for your time with us this morning, Dr. George Haramis.
Thank you so much.
I was for Dr. George Haramis. Doctor, Ohwehwe Junso emu ehaw. And oye adwuma so ewo Luca Health ono na no pay ye ne no etwetwen komo efa kidney stones and afi prostate enlargement ho na osei one numbers no say bia opese oba Luca Health senye bia prostate na kidney stone kra na bibia opese okoye Luca Health no o fresh number is 0544 120 777 0544 120 777 na obetumi abuki appointment say bibia apesa okokoye e wo Luca Health bia no e kwan e da ho na wakwa buki appointment e ho na ukwa na the open no wakwa hwe na ya hedi nyame beye e de amawo Peace 104.3 FM Kokrokoo Mediani. And so all praise to God. All praise be to the Most High God. St. Lawrence Catholic Parish, Achimekropon. Was 25 years a parish yesterday. To God be the glory. This one is to wish you, Mr. Kumi of Fact Motors. Mr. Kumi of Fact Motors from Erica J. I understand you are a member of Operation 5K. Happy birthday to you, Mr. Kumi. A glorious day we wish you. And this is to wish you Hartwell Nana Yao Omari. A blessed birthday from your parents and the entire family celebrating you, Hartwell. To you, Madam Paulina Kobe, ex-prisons officer, currently based in the United States of America. From the entire family celebrating you, Madam Paulina Kobe. To you, Vivian Yeboah of Jache Pramso in Kumasi. From your friend Rebecca Kofi to you. Rebecca Kofi is at Anya NIC. The message is simple. God bless you, Vivian. And to you, Mrs. Perpetua Ufuri Ampofo, President of the Ghana Registered Nurses and Midwives Association. From Daniel Opoku and Frank Ayi of TV3 Newsroom. Ghana Police Service, yes, Ramano pays a mutie. Madam Roma, Monfa money, entre Kutunse. Yes, a free Kutunse, satellite junction ho. Eba Amasaman. Traffic here walk one swano pay no, and yasam kitwa. And Ghana Police Service, Madam Roma, Moan, Yabefremo. Corpora Kwamboating. Madam Roma, for money, entre satellite junction. Eba Amasama Namonsha Homayan. Yes, a traffic na no Dinankasa. To you, Abawa of Abawa Radio United Kingdom, and your husband, Chairman Mugabe, doing the listening this morning. Good morning to you. And Ghana Police Service, genuine way free Sawamoni Pom Ho in a bed, you much less and a watch into your maca. It's a serious traffic jam. It was satellite junction. Kutunse ho eba amasaman. Unfortunately, there are no alternative routes. And Ghana Police Service just a motion my. This is to wish you, Mrs. Precious Edusa Arthur, a public health nurse at Abumosu Health Center in the Tiwa West District of Eastern Region. From your dearest husband, Paul Edusa Arthur, and your children, as well as the entire family celebrating Mrs. Precious Edusa Arthur. A belated one to you, Elder Abigail Tete. Inside Victory Bible Church at Mate Kodan Suman, from DJ Pantalon to you. And this one says a belated one to Enoch Ejin, also known as Pinto. Pinto. Happy birthday to you, belated though. From your sister Elizabeth to you, saying thank you for everything, and may God bless you for everything you have done for her. And to you, Honorable Patrick Yabuama, MP Okankwe Central. Have a wonderful one, MP. From Bounty Benjamin to you, Honorable Patrick Yabuama. Ghana Police Service Yadamwase, as always. And Krana Basen, na Kabina say, Wakwano, so Nanyamia don't wait me a year free hall. Asidaya Mode. This one says a blessed birthday to ASP Yafra of the Prison Officers Training School in Roman Ridge. God continually bless you. From ASP Yvette Siedu, ASP Julius Osu, ASP Yao Akom, and a special one from Lieutenant Otibuate. Lieutenant Otibuate, I'm watching you. I actually am a lie, Momo, Kenneth Francisca, Machima, me why. And to you, Oheneba Kofi Odame Mante of Calf International School in Adenta, from your parents, Mr. and Mrs. Mante, and Pokuya Wendy 101 of Adom FM